Thank you, Katie. Well, colon cancer is the third leading cause of cancer deaths in the U.S. in both men and women. Early testing and treatment for colon cancer is key to saving lives. New guidance released this week is offering stepstones for when people should start seeking cancer testing. Well, joining us this morning is Dr. Ahmad Akasani, Director of Gastrointestinal Pathology, UF Health Jacksonville. Doc, it's so good to see you. Good morning.
Good morning. How are you doing?
I'm doing well. So, Doc, very serious and important questions to ask you here. So first, can you talk about more on what colon cancer is and who is at risk the most?
So colon cancer, it's the leading cause, one of the leading cause of death among the patient population. The American Cancer Society expects around like 150,000 cases of cancer to be diagnosed in the year 2023. And the estimate for the mortality or the death from colon cancer is around 52,000 for the year 2023. Now, individuals who are at risk of colon cancer is someone who had a precancerous condition, which is known as a colonic polyp. So if someone has this one, he's at risk of cancer, and now we have prediction models that this polyp is actually eventually in 10 to 15 years is going to turn out into a cancer. The second population is someone who has a family history of cancer. So if you have a relative who has a cancer, especially at younger age, some younger than 60, this is a risk factor. And actually the guidelines, they recommend screening these patients at earlier age than the age of 50, even for these patients, if they were diagnosed at an early age. The third thing, there are some conditions that predispose to cancer, such as inflammatory bowel disease, such as ulcerative colitis and Crohn's disease. These patients are at risk, especially after 8 years from diagnosis. And the last thing is that there are patients who have some genetic condition that predisposes them to cancer, such as familial adenomatous polyposis. And these patients are often diagnosed in their 20s and 30s, and the hope is to catch them earlier so you can diagnose them before they even have symptoms and can take care of it.
And you pointed out something very important there, because that's something that's been prevalent in my family as well. So how important is screening for prevention and treatment?
Well, screening is actually the way to go. It's the most important thing for every individual to talk to their primary care physician about the time to start their screening. So colonoscopy or fecal testing, which is a test that can be done at home, they have shown unbelievable results in decreasing the rate of colon cancer. It has decreased it around like 33, even up to 70% of cases. It decreases the incidence of cancer. It decreases the incidence of more advanced cancer, especially if we pick up cancer at early age.
So, Doc, you would say it's better for you to test earlier and earlier, definitely if it's in your family.
Definitely, the earlier the better. And actually the guidelines, they recommend testing. Like, let's say if you have a relative who was diagnosed at the age of 55, the screening for the first degree relatives should start 10 years earlier, which means at their age of 45, they should start. And even sometimes we start at the age of 40 just to make sure we can catch cancer early and hopefully prevent any spread of the disease or advanced disease that may cause mortality down the road.
And is there any specific message you would want to send to families right now who are already battling colon cancer?
Well, I would say like the most important thing is actually to, first of all, look at the screening, talk to your primary care physician, let them know that you had a family history of cancer, you have like a risk of it, raise your concerns, and make sure that you get your screening done as soon as possible. Now, there are several options for doing screening. You can do like a home test, like where you examine the feces for the presence of like some blood or some DNA on it, or they can do like visualizing of the colon through scheduling a colonoscopy where they can go to the colon and look at it. So whatever option they feel comfortable with, I would talk to my primary care or to their GI specialist and make sure like they get scheduled to make sure that we can prevent even before cancer can happen.
All very important information there. Thank you so much for your time this morning, Doc. We appreciate you.
Thank you for having me. Have a good day.
You too.